Hi, everyone. Welcome to Women Empowerment Shadowing Session. Today we have Dr. Laura with us who will be talking about clinical pharmacy. Thank you, Dr. Laura, for joining us today. Whenever you feel ready, please begin your presentation.
Hey, thank you so much. That's a really kind introduction. Thank you for having me today. I'm super excited to join you and talk a little bit about my job because I think I have the greatest job ever. I'm super passionate about it. And I'm excited to tell you a little bit of my background and how I got here and some of the alternative ways that you can get into clinical pharmacy. So like she said, my name is Laura Holiday. I am a pharmacist from Oklahoma. My official title is PACT Clinical Pharmacy Specialist, and I work for the Department of Veterans Affairs. Here's a little outline of what I'm going to be discussing today. I'll, like I said, give you a little bit of my personal background and then talk you through the educational routes available to become a pharmacist and then a clinical pharmacist, as well as a few other things. I'll give you an example of, my education and give you just one example of how you can get to the point that I'm at today. I'll talk quite a bit about the different types of pharmacy practice because there are a lot of them, which tends to surprise people. And then after that, I'll kind of detail my day-to-day life at work because my job's pretty unique and it's really different than what most people think of when they think of a pharmacist. And then at the end, we'll do a little Q&A. So if you guys have questions, I am happy to answer them. So here's just a little fun slide about myself. I am originally from Texas, but I grew up in a really small town here in Oklahoma. I live and I practice around the Tulsa, Oklahoma area. So I live just north of Tulsa, and then I commute every day to a small rural clinic where I practice. I've been practicing pharmacy for almost 3 years, so I'm pretty fresh out of school, very fresh out of training. I did some postgraduate training, and it's pretty crazy that it's already been that long since I graduated. Even crazier, I've been married for almost 4 years to my husband, who is also a pharmacist, and we live in, like I said, north of Tulsa with our 2 cats. I have pictures of them there. My husband's there on the left, obviously. And then my cat, Oliver, is there on the top. He's the big fluffy one who's taking a nap. And then the small one at the bottom is Eslin. A few of my favorite things are traveling whenever it is, allowed and appropriate. Macaroni and cheese. I will never turn down a plate of macaroni and cheese. And I've really gotten into indoor gardening over the last year. I am a self-proclaimed plant lady, and I have been collecting plants over the last few years. Really into skincare. And then I also have a lifestyle and educational blog called prettybutwitty.com. So talking a little bit about education, here's kind of the road to getting your PHARM.D or your doctorate of pharmacy. I have this sign here because there are a lot of twists and turns that you can take, but eventually you'll all end up with your doctorate of pharmacy should you choose to make that your goal. So as far as required education, obviously high school graduation is very important. Undergraduate education as well. Different pharmacy schools have different recommendations and requirements for undergraduate education. Some pharmacy schools require that you get a degree prior to applying. The pharmacy school that I attended did not require that. They just had prerequisite college credits that I had to have before I applied. I didn't have to actually have a degree. So I did not do that. I just did 2 years of undergraduate education and then went straight into pharmacy school. Then you have pharmacy school, obviously, which is the important part. It is 4 years, and for the most part, there are exceptions to the rule, but for the most part, it's 4 years of training, 3 years of didactic work, and then your last year you spend doing clinical rotations. They're usually set up different from school to school, but there are certain, national requirements that they have to follow. For me personally, my school, we did 9 different rotations at different practice settings, and this is to just expose you to the different types of pharmacy practice, and that way you can get your feet wet in all the different types of pharmacy that there is to offer out there. Next up is postgraduate training, and I mentioned that I did this. It is optional. Is not required by any means. It kind of just depends on what your end game is and what you would hope to achieve as far as your career. There are a couple of different options. There are more out here. These are just the two most common. Residency, which is what I did. And that is if you have more of like a clinical aim in your career. So if you want to be more of a clinical pharmacist like I am, residency is a great idea. You absolutely do not have to do a residency. It is not required. Like I said, it's totally optional. But it definitely is helpful in like jumpstarting your knowledge and training. The other thing that you can choose to do is a fellowship. And I would say that this is more aimed toward those of you who would be more interested in research and development and working more in the pharmaceutical industry, not so much clinical practice. Next would be board certification. Again, this is totally optional. So if you do practice for several years or you do a residency that has some sort of specialization, you can get board certified in several different kinds of specialties. So my specialty was in internal medicine. There's not currently a internal medicine board certification, but since internal medicine is so broad, I actually did board certification for pharmacotherapy. So it kind of just covered all of it. So that basically matched up with what my training was, and I felt like that was a good representation of my knowledge. And so that's what those extra letters were at the beginning behind my name. So that BCPS means Board Certified Pharmacotherapy Specialist, and it's totally extra. And it just kind of shows that you have put in the extra work, and you're maintaining this extra certification, doing extra, more difficult and intense continuing education. Speaking of continuing education, there are requirements for board certification, but also to maintain your license. And this one is not optional. How much you do depends on how many certifications you have, but pharmacists are licensed by the state. And so continuing education requirements vary by state. Some states require you to have live and non-live CE, and that you have to have so many hours of each. Oklahoma does not require live CE at this time, so I just get my set amount of hours every year and I'm good to go. That's how I can maintain my license. Okay, so speaking of my license and my education and all that good stuff, I'll kind of walk you through exactly what I did. This is not a one size fits all. This is just an example. So you kind of have an idea and a timeline of how many years. So I went to high school, like I said, in a really small town in Oklahoma. So that was 4 years. And then I did 2 years of undergraduate education at Southwestern Oklahoma State University in Weatherford, Oklahoma. We fondly call it SWASU. So if you hear me say SWASU, that's what that means. And then I also went to pharmacy school at SWASU. They have a college of pharmacy there that has been there for years and years. It's very well established. And it is located in a small town. There's two pharmacy schools in Oklahoma. There's one at the University of Oklahoma, also a very impressive program, and it's located in Oklahoma City. And then there is SWASU. So I looked at both and decided ultimately that SWASU was a better fit for me just because of the location. It felt a little bit more like home. It reminded me of my hometown. It was just on the other side of the state. So I decided to call SWASU home for 6 years. Like I said, I did 2 years of undergrad and then 4 years of pharmacy school. My last year of pharmacy school, like I mentioned, we do clinical rotations for that last year. So I did actually move to Tulsa, and that's how I got connected with the pharmacy community here. Pharmacy is a very small world, and everybody knows everybody, which is great. And I really, really, like I said, got connected with the pharmacy community in Tulsa and fell in love with it. And that summer prior, I had gotten married too. So my husband, he works in Tulsa as well. And so we just really fell in love with it, and I decided to seek out a job here in Tulsa. So after that, once I graduated, I pursued a residency, and I did a PGY1 residency, just a pharmacy practice residency, meaning that it was very general, which was great because I knew that I wanted to do further training, but I didn't know if I wanted to do a PGY2. I didn't know if there was a particular specialty that really spoke to me. I just knew that I was a big nerd and I liked helping people and I liked being part of the team. So I decided to do the pharmacy practice residency because it was so general. And I did that at Oklahoma State University Medical Center, and it is located in downtown Tulsa. It is an academic medical center. So there was a heavy academic focus, but I got a lot of good inpatient and outpatient experience, as well as working with their College of Medicine and all the other residency programs that they have at that hospital. So great experience. I realized that about halfway through the year that I did want to pursue more training. And I realized that we were going to start an internal medicine pharmacy residency as far as a PGY2. And so I applied for it and ended up getting it. I was really thrilled to continue my training and did an internal medicine second year of residency at the same hospital, which was great. And it was in conjunction with SWASU, so that was pretty neat. There was a little bit of an academic focus, so I got to come out to my alma mater and teach a few lectures. I got to teach a few lectures at the College of Medicine. We had lots of residents and pharmacy students and medical students and nursing students. So it was a heavy couple of years of learning and being in a really educational environment, and I really enjoyed it. Next up, once I was finished with my second year of residency, I felt really confident in pursuing board certification, like I said. So there's that board certified pharmacotherapy specialist designation. And I did get that over the summer. So that was really exciting. It was a really tough exam. You can actually get certified in several different things. A few examples being cardiology, oncology, pain and palliative care, geriatrics, ambulatory care, which is something that I'm potentially considering, and I'll explain why in a little bit. But yeah, there's lots of different options, and it's a fairly new thing, but it is. I don't know. I think it's something just a little bit extra that shows that you put in the work and you are continuing to learn and better yourself in your education throughout your career. Okay, so just a few fun facts about pharmacy. I don't know how much you guys know about pharmacists or the history of pharmacy, but I have a few things that I wanted to share because I think they were interesting. All of our favorite sodas in the United States were all invented by pharmacists, which I think is super interesting. So, Coca-Cola, which most people know was invented by a pharmacist, but also Dr. Pepper and Pepsi were invented by other pharmacists as well. So I thought that was a pretty cool fact. The first licensed pharmacist in the US was located in the French Quarter, so in Louisiana. Louisiana was the very first state to require that pharmacists have a license. Up until then, they were just drugstore owners, and they compounded things and made their own remedies, and there was no types of regulation or pre-made, prefabricated medications. They were all just either raw ingredients or things, little potions and things that the pharmacist would whip up. And actually, another thing that was pretty cool about that pharmacist in the French Quarter, he actually practiced both modern medicine at the time in 1816 and then voodoo medicine as well. So it's a pretty cool story to read about if you ever get a chance. And the other thing that's interesting is just about the pharmaceutical industry in general. 6 out of 10 of the top pharmaceutical companies in the world have headquarters in the United States. And I would suspect that it's because of this next fact, and that's that the US population makes up about 47% of the global market for pharmaceuticals. And that includes medications and herbals and supplements and all of that good stuff. So kind of interesting to know. Um, and then the biggest thing is that pharmacists are the most accessible healthcare worker. So we've all probably come into contact with a pharmacist at some point. The picture that we have in our head probably looks a lot like this young lady on the left, excuse me. Somebody behind a counter filled with shelves and shelves of medications, hopefully with a smile on their face, but sometimes not. It gets a little busy back there. But you think of a retail pharmacist, and I think that's fair. That's a fair assumption that that is a lot of what we do, but there are so many other kinds of pharmacists. So I have the picture on the right, which kind of shows a little bit more clearly what we do, which is a little bit of everything, constantly juggling, helping both our patients and our coworkers. So I feel like one big thing with pharmacy is that you need to be really good at communicating with patients. That's something that's huge. We counsel patients on how to properly use medications. If they're having problems, we can help them troubleshoot things. But you also have to know how to speak to a physician or a nurse practitioner or a nurse or a physician assistant, anything like that. So I feel like communication skills are key in terms of being a pharmacist. But if you're not a social person, there's also jobs for that. So do not fear, because there are many types of pharmacy practice out there. This is not an all inclusive list. This is just all the things that I could come up with off the top of my head. And I probably missed some really important ones, but these are the ones that I could think of. And so, like I said, community pharmacy there at the top, that one is the one that we all think of. That's the person at the big box retail stores that are behind the counter with their head down, working super hard, and who come over and help us when our kids are sick, or whenever we have a problem, making recommendations for over the counter products. But there's all of these other options too. So I'm going to kind of go through each one and just give you a few little tidbits, just as food for thought. So if you thought that you didn't want to work at a big box retail store for the rest of your life, then do not fear, there's more options. Hospital pharmacy is another one that's pretty big and people don't really think about it. These are the people who are working in the pharmacy in the hospital and helping to verify orders that physicians and other providers put in at the hospital. So any order that gets put in for a patient for a medication at the hospital has to be verified by a pharmacist. So hospital pharmacists are also very busy, but they are not, open to the public. They are helping inpatients, as well as nurses and everybody else who works in the hospital. Clinical pharmacy kind of encompasses a lot of things. You can practice in a lot of different settings. So, as a clinical pharmacist, I've practiced in the hospital, practiced in outpatient clinics, and that's what I do currently. So that's just kind of an overarching thing in different settings, meaning that you aren't doing so much dispensing of medications. You're kind of helping with the knowledge part. I kind of feel like as a clinical pharmacist, your life is just like one big, like, fill in the blank test. You never really know what somebody's going to ask you. um, like yesterday, for example, I was helping finish up a project finding tablets for a patient who was allergic to a really common inactive ingredient that's used to make tablets, and they needed a medication. And so I was having to go through like all the package inserts and find a tablet that would work for this patient. And so really, you never know what you're going to be asked. It's super random, but that's what kind of makes it fun. You never really know what you're going to get. Um, Industrial pharmacy is kind of like what it would imply would be like pharmaceutical industry. So you're working to help the big drug manufacturers and research developers come up with ideas and help with just bringing that pharmacy knowledge to their perspective, because that's not something that they typically think of. Compounding pharmacy is still alive and well. They um, are great. They help basically fabricate medications in different dosage forms. So, say a patient can't swallow a pill or a tablet, they can sometimes make things into a liquid or something that's easier to swallow. They make suppositories. They make, when I was a student, I helped out at a pharmacy that did some compounding, and we made lollipops with lidocaine in them. So it's for people who had a sore throat. It was pretty cool. They make capsules. They make all kinds of things, just more customized for the patient, which is great. There's a lot of rules surrounding all of that, and I won't bore you with the details, but that's a pretty cool job. Consulting pharmacy. So these are people who kind of help out with like bigger companies and kind of working as like a liaison, again, providing more pharmacy perspective than anything else. Ambulatory care pharmacy, which is what I do. So this is a pharmacist that practices in an outpatient setting, has a lot of direct patient care. And I'll talk to you a little bit more about that in a second, just because that's what I do right now. So I'll bore you with the details of that here in a bit. Drug research and development, pretty self-explanatory. Academia is a big one. Something that I for sure eventually would want to pursue. I think it's a really cool thing to want to give back to your career and help out with students. As a pharmacist, in some form or fashion, you're probably going to be involved in academia in some way, because you have students coming on rotations. You have potentially residents at your place of work. And so you're constantly kind of giving your knowledge to the next generation, which is so cool. So neat to be able to do that. But there's also the opportunity to not so much work in clinical practice, but to actually do more of the like didactic lectures and things like that. Regulatory pharmacy is someone who works for the government. So they kind of help develop, implement, and enforce the laws set out by the federal government or the state government. So, for example, if you work for the FDA, if you work for the CDC, things like that. Home care pharmacy. So, there's a few different things that come to mind when I think of home care pharmacy. So, there's pharmacists who specialize in home infusions for patients who are undergoing chemotherapy or they are undergoing palliative care and they require infusions intravenously that need to be administered at home or in a clinic, either way. Then there's veterinary pharmacy, which I think is pretty cool. They do a lot of compounding and they get to use a lot of drugs that are not approved for humans. So that's like a whole other stratosphere of knowledge. I think that's pretty neat. And then, like I said, there's different pharmacy specializations. So these aren't necessarily settings, but these are things that you can potentially specialize and get board certified in. So, like I said, oncology, cardiology, internal medicine, like I did, emergency medicine, which is cool. Emergency medicine, pharmacy wise, is a little bit of a cool mix between like ambulatory care and critical care. You can also specialize in critical care, which is neat. Pediatrics, that's a big one. I have several friends who are pursuing that. Psychiatry, infectious diseases, nutritional support. So pharmacists make the TPNs, which is like the liquid supplementation that people get in the hospital when they can't actually eat with their mouth or if their gut's not working for some reason. Pharmacists can specialize in that and help out with the dietitian and the physician and the nephrologist, and they can all kind of powwow and make the best decision for the patient. Pain and palliative care, I have a few friends who do this as well. That kind of goes hand in hand with geriatrics. And then poison control is another cool one. I know several people who have kind of gotten into the toxicology world and help out with our poison control center. So that's neat. And like I said, there's so many more. This is not, like I said, an exhaustive list. This is just to kind of open your eyes to the possibilities that are out there. So moving right along, here is my practice setting. This is actually my clinic on a very beautiful day. I work in an outpatient primary care clinic. So I work for the VA. So our veterans are basically just coming to see their primary care provider. And it is ambulatory care, meaning it's in an outpatient setting. The patients are not sick enough to be in the hospital to warrant hospitalization, although sometimes we do have to send them to the hospital. But anyway, this is just a regular clinic that you would think of like if you were going to the doctor. So I worked, because I work for the Department of Veterans Affairs, the VA handles things a little bit differently. So veterans are assigned to what's called a PHARM.D team. And you'll have noticed that in my title, I'm a PHARM.D clinical pharmacy specialist. That's my official title. And PHARM.D stands for a patient aligned care team. So patients, when they get assigned to a PHARM.D, they usually have some sort of color that sets them apart. So, for example, a patient might be assigned to the blue team, and each team is made up of a primary care provider, so an MD, a DO, a nurse practitioner, a physician assistant, some sort of provider, and then they also have nurses, social workers, pharmacists that are on the team, mental health practitioners, and dietitians. There's other options as well. This is just a good example of what goes on at my clinic. As the pharmacist, I kind of take care of multiple teams. So I'm not assigned to just one team. But it's kind of nice to know that when the veterans come into the office, they have access to like their people who know their story and what's going on with them. So it makes it a little bit easier for them to get really personalized and coordinated care with everybody that needs to be involved. So as the clinical pharmacy specialist, here's my official job title or job description that I literally copy and pasted from my application. I'm responsible for providing and documenting pharmaceutical care of assigned veterans with PACT programs. So I basically function, like it says, at the highest level of my practice. And I basically serve as a mid-level provider, which is really cool because in Oklahoma, pharmacists do not have provider status. And because this is a federal job, I don't necessarily have to play by those rules. So I have a scope of practice that lines out exactly what I am and am not allowed to do. But because of that, I am able to use a lot of the knowledge that I gained from all my training and from school. And I meet up with patients individually. So I basically have my own clinic. So what happens is patients will get referred to me by their provider as if they were referring them out to a specialist. Hence the clinical pharmacy specialist title. And the patients will then, well, schedule an appointment. I'll give them a call. I'll see them face to face, or we'll do some sort of like video chat situation. And I'll see them and kind of help manage their care as far as medicine goes. So that I kind of gave you a little outline of that. So like I said, face-to-face, telephone, and secure video chat are the three methods by which I see people. So telemedicine is huge in my job, especially right now with all of the restrictions with COVID. Here are a few of my daily duties as far as patient visits go. So I evaluate and direct therapy to make sure that patients are safe, their medications are effective, and that we're also using medicines that are cost effective for our health system. So that's kind of a lot just in itself, that first bullet point. Because safety and efficacy are the two main things, right? But then you also don't want to be wasting money unnecessarily for the health system. So I kind of have to have that balance of getting the right level of care for the patient, making sure that they're appropriately taken care of, while also doing things that are cost effective. I am able to order and interpret labs, which is great. I do occasionally perform physical assessments, so taking blood pressure, simple things like that. Initiating, modifying, and discontinuing medications as defined within my scope of practice. So I can order medications. I can essentially prescribe within the VA system. So I can't just like write a prescription and like send it across the street to Walmart. They're not going to fill it because I'm not allowed to prescribe medicine in Oklahoma. But within the VA system, I am allowed to do that. A lot of our patients get their medications from the VA, which is great. And so they receive them via mail. We do a lot of mail order pharmacy. And so that has been a little bit of a change because, you know, in my training, I was grown up in pharmacy in Oklahoma. So I did a lot of recommendations and I did a lot of the decision making as far as what patients should get and recommending that to my team. But I never was the person who actually made that final call. So that was a little bit of a transition, but it's getting a little easier and I'm getting a little more comfortable with what I like to do. And then conducting timely follow-up. So I set up follow-up for my patients. I schedule them for follow-up visits. I call them all the time. They're probably tired of hearing from me. And then I have to know my scope of practice really well because I need to know when I need to refer that patient to a higher level of care. A great example of that would be one of my patients with diabetes who is just all over the place and not responding to what I am able to do for them. So at that point, that would maybe be a time when I would refer them to the endocrinologist because they require that more advanced, specialized level of care. So that is just something you have to know your limits. You have to know your scope of practice and your own knowledge, and not be afraid to say I don't know and do the best thing for the patient and send them on to, like I said, that higher level of care. A few other of my daily duties. So when I'm not seeing patients, I'm doing this among other things, but comprehensive medication reviews. This is another big part of my job. I do what's called medication reconciliation, and I try to do this at every visit for the most part. And medication reconciliation is huge for pharmacists. It's typically not done by pharmacists, which is interesting. It's typically done by nurses, especially in the hospital. And this is when you ask a patient what they're taking, how much they're taking, what they're like why they're taking it. Are they taking anything over the counter? And these little details, it can take up to, 30, 45 minutes to do one of these medication reconciliations, but it's always so worth it to make sure that you're on the same page with the patient and that you know exactly what they're taking so that you can make appropriate recommendations and changes to their therapy without doing something unknowingly wrong or unsafe. So yeah, medication reconciliation is a big one. Got a lot of training on how to do them well when I was a resident. And so I'm very passionate about it. And I think it's very important. It seems like a very like fluff part of the job. Just give me your medication list and tell me what's going on. No, you need to know all those details. Super, super important to know. Um, Patient medication counseling. This is a fun part for me. I love talking to patients and teaching them how to use things. So how to use their glucose monitor or their CGM, or how to take medications, what to expect. Is there something dangerous that they need to know about? Is there something they should or should not eat or drink? Do they need to eat or drink at all? Can they take this medication with water or milk, or does it have to be something else special? It's all it's all part of that specialized pharmacy knowledge that you, as a pharmacist, have to be really on top of and make sure that the patient is equipped with all of the knowledge that they need in order to safely take that medication so that it can do its job and that they won't be harmed in the meantime. Um, Providing educational medication resources to patients and caregivers. So I do my best to provide legitimate resources for my patients. I try to avoid Dr. Google with my patients as much as possible. So I try to give them paper copies of things, or if they're tech savvy, I do try to give them websites that give them legitimate information that I feel comfortable with where it came from, and that they'll if they forget, they'll be okay reading that information as a reminder for things that we talked about. um, Verify and document patient understanding of information provided. So after I've had a patient visit and I've given them all of this information, do they understand? Did I convey the information appropriately, and did they understand it in the way that I was meaning it? So I typically have patients talk me through what I just told them. So I'm like, okay, tell me exactly how you're going to take this medication. Tell me exactly what you're going to do whenever you need to check your blood sugar. What are you going to do if this happens? So I always joke that I give them a little pop quiz at the end of our visits, because um, they basically get a little pop quiz, and I make them review everything just to know that we're on the same page. Make sure that I'm doing my due diligence. And then those two activities between patient visits and med reviews, those are like probably the bread and butter of my job. But in the meantime, I'm also getting random drug information requests and different e-consults for different things. So these can be various. This was one of those, hey, my patient has an allergy to this really random thing that is commonly used to make tablets. What do I do? So it's just a matter of getting really good at using your resources and being really good at looking stuff up. Because there's no way that I would know that off the top of my head, and that's not necessary. But knowing how to look it up and looking it up efficiently is very important. So these are a few of the disease states that I commonly manage in my practice. Diabetes and hypertension and hyperlipidemia are probably the top three. I also have a few heart failure patients. I do tobacco cessation with my patients, and I also have a few hypothyroidism patients. And this is because, you might ask yourself, well, why isn't the provider doing this? Well, the provider has a lot of patients to see. And they aren't able to, if they make an insulin adjustment for a patient and they can't follow up with them for 3 months, that's not quick enough. So I'm able to follow up with them every couple weeks, sometimes every week if I need to. And a lot of these conditions are heavily medication managed, and that is what a pharmacist does. Like, we know everything there is to know about medications and how they should be appropriately used. And because of that, we also know how to change things and troubleshoot things to hopefully prevent things from getting worse, and to promote really good outcomes for these patients. So I help manage them after they've already been diagnosed. So I don't diagnose things. I just get sent patients who need a little extra help with their medications, or it's totally new to them and they just need somebody to kind of hold their hand and walk them through it. And that is so fulfilling and so wonderful. And I think it's really cool that the Department of Veterans Affairs respects pharmacists in that way, so that we're able to really shine and do what we do best. So like I said, the way it works is patients get referred to me as if I were a specialist. So I'll have an e-consult pop up explaining the situation, or I'll have a provider walk across the clinic and say, "Hey, got this patient. Here's the deal. What do you think?" And sometimes they just want to know like one question, but sometimes they're like, "Will you just take them? Like, will you just fix them and we'll just get them all fixed up and worked out and it'll be great." And because of that ability to do frequent follow up and that drug expertise, I think it just helps us like fit into that puzzle so perfectly. And I don't know, I think it's really cool. It's exciting. Um, that is pretty much it. I wanted to let you know where you can find me on the internet if you have questions or you want to know more or you want literally anything. I'm happy to talk about it. I'm thrilled to talk about it. So I have a blog, like I mentioned, it is prettybutwitty.com. You can email me at prettybutwittyblog@gmail.com. And the link to that email address, if you forget it, is on my Instagram, which is at prettybutwitty. So I'm usually really good about getting back to you guys. And if you have questions, like I said, I'm thrilled to talk about it. I have met up with several people via like Zoom to just kind of talk about things as well. So that is also an option that I'm totally willing to do. But yeah, I am an open book. So feel free to ask me any questions that you guys might have.
Thank you so much for your presentation. We do have some questions on YouTube. So the
Awesome.
first question would be, how did you manage your time effectively in pharmacy school?
Ooh, yeah, that was a learning curve for sure. I was because I think because I only did 2 years of undergraduate studying in college, and then I was just kind of thrown into pharmacy school. It was sort of a sink or swim situation because I truly didn't know how to study. Um, they were really challenging classes. I did a lot of extracurricular things as well. And I am a huge fan of time blocking. I still do this at my job every single day. And this strategy works really well for me. So I basically will write down everything that I need to do. I will just like word vomit onto a page and think about every single thing that's stressing me out that I need to get done and accomplished. And then I try to prioritize it. So every day I try to pick 3 things that I need to accomplish that will make me feel better, that I absolutely have to get done that day. And then the rest of it is all kind of a bonus. So I pick my top 3 for the day and then I time block the whole day. So I'll say I'm going to do this project for 2 hours and then I'm going to take a 30-minute break and then I'm going to work on this for an hour and then I'm going to take lunch and then I'm going to do that. So I try to be flexible and keep in mind like how long is this going to actually take me to do this. But when I know that I have this chunk of time to get one particular task done or one particular project done, I think that really helps me um, manage my time and prioritize the things that are important without getting distracted.
How did you know that this is the field you want to be in?
Ooh, I like this question. And that was a good question. I didn't answer that. I decided that I wanted to be a pharmacist when I was 16 years old. I remember very vividly having a conversation with my mom. I knew that I wanted to go into healthcare in some capacity, but I just didn't know what. And I was at the point in my high school career where I kind of needed to start preparing for college and doing some research. And I remember we went to lunch and I remember I had like soup and a sandwich. I remember this conversation so vividly because it just all made sense and like fell into place. But she really encouraged me to think about what I wanted my life to look like um, after I graduated from college. So she's like, you want to be in the medical field, but do you want to be on call all the time? Do you want to be able to take vacation? Do you want to work set hours? Do you want to be able to have a family? Like, how important is work to you in regards to all these other things that are important to you in your life? And so we kind of narrowed it down, and I decided that um, based on the things that I enjoyed doing, which, helping people, working with patients. I loved chemistry at the time, so that helped a lot. Chemistry is a huge thing with pharmacy. And so by doing that, we kind of worked backwards and we figured out that pharmacy was a really good fit. And so I started shadowing some local pharmacists and talking to a few of the other people who were in the field as much as I could. And I figured out that that would be a really good fit for me. And so I started to do research in pharmacy schools and it all worked out.
Can you administer vaccines?
Yes, so pharmacists are allowed to administer vaccines in all 50 states, which is very exciting. I currently do not because I have lots of lovely nurses who do all of those things for me. Retail pharmacists they do that a lot. But my husband actually signed up for a few of the COVID vaccine clinics, and he's been doing that on the weekends and helping out with that. And I'll probably start helping him out with that pretty soon. Um, so yeah, we are able to, in short, administer vaccines, which is pretty cool.
How is your work schedule like?
So now it's great. I work 8 to 4:30 Monday through Friday. So I'm on a clinic schedule, which is fantastic. As a resident, it was not that great. I currently do not work any weekends. When I was at PGY1, I worked a lot. I worked every other weekend, and I worked very long days at the hospital. But that that's temporary, and that that's not going to be forever. Um, One thing with working in a hospital is that it is shift work. The hospital is never closed, unlike the clinic. So you have to keep that in mind. So if you never want to work weekends, the hospital may not be the best place for you. Um, Clinics are great because they're closed and there's not new work when you show up in the morning because nobody was there. And so right now that really works for me, and I really enjoy it because it allows me to do things outside of work that are important to me and that I enjoy doing. So it kind of just depends on where you end up. But right now it's pretty great. No weekends and 8 to 4:30.
What is the hardest part of your job that most people don't know about?
Oh goodness. I think this is different for everybody, but for me personally, I I'm a sensitive person, and I try to I try to find that line of being really empathetic with patients, but not letting it affect me, and not taking it home. Um, I dealt with this a lot more in the hospital, just because you see a lot more intense situations, and you see people pass away, and that's kind of hard. That was something I'd never seen before as a student, and never something that I thought I would see or wanted to see. But it happens, and it happens every day. Um, as as an outpatient pharmacist, I've developed relationships with my patients, and so it's kind of the same thing. I have to find that line of having a really great relationship and a rapport with them, and gaining their trust, but also not getting too wrapped up in it. So for me, it's just a matter of protecting my heart and protecting myself, but still maintaining that sense of empathy for my patients.
How do you deal with the advancements in pharmacy, such as new medication and new knowledge that comes with it?
Yeah, that's a great question. So it's kind of like drinking out of a fire hose. There's so much all the time that's coming out, and the the CE that I do for my board certification is really helpful for that. That was another reason that I wanted to get my board certification, because I knew that the information that comes out for that particular certification is all of the newest, latest, greatest updates. And so that's been a really easy way to help me keep up with it and know that I'm doing my best. There's tons of organizations that send out email newsletters, and I sign up for the ones that I feel like are relevant for me, and I try to read through them. It's impossible to read everything, but I think just maintaining a sense of curiosity and that willingness to learn is really important throughout your career, because you're never going to stop. Pharmacy has changed so much in the last few decades, and it's not going to stop. It's going to get better, and it's going to get more complex, and so I think that's one thing to keep in mind when you do get into the field of medicine, is that you're going to be learning for the rest of your life.
What is something that you would want to change about your field?
Ooh, man, that's a good question. Sometimes I wish that we were advocated more, advocated for more. And I do my best to do this, on my own terms and in my own way. But sometimes I feel like people don't know what to do with this. There were a lot of instances in the hospital where I would like show up for rounds with the team, and like the new residents were like why are you here? Like, what do you do here? And it's kind of hard to explain until you kind of prove yourself. But then it's great. I had a I had a really supportive residency program, and the physicians there were very pro pharmacy and very respectful of our field. And the chief medical officer and one of the attending physicians at the hospital used to always say that a clinical pharmacist was as handy as a pocket on a shirt. And so that attitude kind of trickled down from the top. And thankfully, I was really spoiled to have a very respectful institution to work for. But I know that that's not the case everywhere.
What tip would you give to your younger self going into this field?
Ooh. I think just to know that they're like, just to say yes to every opportunity. Um, I think there were times in pharmacy school and residency where it was easy to let yourself get burnt out because you were working so hard and you were learning so much all at once. And I think just like remembering that it's temporary and that it's going to be so worth it. I should have reminded myself of that. And now looking back, I'm like, man, let's do that again. Let's learn some more stuff. But at the time, it's exhausting. It really is. It's hard. But it was 1,000% worth it.
What do you do in the instance of a misdiagnosis by a PCP?
So thankfully, I have great relationships with all my providers at my clinic. I have 3 providers, I have 2 nurse practitioners and an MD. And I feel very comfortable walking into their office and saying, hey, can we have a conversation about this? Not saying, hey, you're wrong. That's never the way to approach it. In this, what do you think? And thankfully I feel comfortable enough to do that, and they're open-minded enough and respect me enough at this point to think about it and take it to heart. And we can usually have a good conversation about it. Typically, it's more of a, oh, thanks for catching that kind of situation, not like a who the heck do you think you are kind of situation. But I think it's just a matter of knowing personally your providers and getting a rapport with them and gaining their trust, and just having a conversation. I think you're advocating for your patient first and foremost. And if they know that you're coming about it from that angle, then I think you'll be fine.
How has your daily life changed since COVID-19? Are there certain precautions you take or anything you do differently?
So yeah, I as far as like my daily work life, we obviously wear masks when I have face-to-face visits. I do a lot of telemedicine right now. So I'm looking forward to being able to see more patients face to face because I feel like I can connect with them a little bit better. And even now, it's kind of hard to connect with them when I have a mask covering like my whole face. But it's hard to get to know people and gain their trust just over the phone. I'm just a voice on the phone, not a real person. So I'll be excited to have more face to face patients for sure.
Have you ever faced any discrimination being a woman in STEM?
Ooh, yes, that is a good question. I actually I had an incident last week actually. I've had lots of incidents in the hospital. Getting confused automatically for a nurse, which is disrespectful on both sides. I feel like they assume because I'm a small young woman that I'm a nurse. And that's like no disrespect to nurses at all. They shouldn't be like what if it's a male nurse? They are sometimes assumed to be physicians and they're not. So I think it's really interesting the fields that are stereotypically one gender or the other. Pharmacists are primarily women that I work with. All of my higher management are women, which is great. I'm really excited to have like female leadership, and I have a lot of female coworkers. So it's pretty fantastic. But I had a situation last week, and I was basically not called a pharmacist. I was called like the pharmacy lady in a note speaking to a patient. And so I had to kind of clarify the situation because I felt like it was not super disrespectful, but I just wanted them to know that I am a pharmacist and I do have a doctorate degree, and am a provider in their clinic. And I just wanted to make that clear, and that I wasn't like just like there, and that I did have all of this knowledge and training that I'm there to offer them, but I didn't want a patient to be confused about who I was and what I do.
I believe this is the last question we have. If you're from Canada, is there a separate pharmacy exam that you need to do per state, or is there only one general one in the US?
Oh, so in the United States, that's a great question. So for getting your pharmacy license, you take what's called the NAPLEX. And that is the pharmacy knowledge type test. So there's compounding questions and drug interaction questions and pharmacotherapy and all of this great stuff. And then to get licensed in your state, there's two requirements. You have to pass the NAPLEX, and then you also have to pass that state's law exam, because every state has different laws. And that's why you can't just get like a blanket pharmacy license. You have to get like one state's license. So they each have their own law exam, and that's called the MPJE. I think California has a different one. I think it's the CPJE. Forgive me if I'm incorrect, if somebody knows more than I do, but I did have to take the MPJE for Oklahoma, and then I took the NAPLEX, and those are the two exams that you need to get your pharmacy license to be able to practice.
So we received another question, which
Yeah.
is, how is the pharmacy research in USA? Are there many opportunities?
I don't know if I'm the best person to ask this question. I have not participated in a ton of plans in the works to get more involved. I'm just not involved very much right now with the academic community. I was when I was in residency, A, because it was a requirement, and B, because that's just something that they prioritize. And ever since I graduated from residency, which was not that long ago, I've kind of just been laying low as far as research, but it is something that I want to get back into more personally. And I think it's just a matter of having that mindset. My pharmacy school didn't push it super hard either, so it wasn't really something that comes naturally to me. And so I think it depends on your training and where you come from. But there are people doing great work out there, and I think it just depends, like I said, like where you come from, where your training's at, where you're practicing. That's a huge thing. And so if that's something important to you, that's definitely something that I would seek out whenever I was researching schools or jobs.
Thank you, Dr. Laura, for joining us today and teaching us about this field. It was an amazing presentation. Now, for those watching this, the link to the quiz will be posted on our link tree found in the Instagram bio and has also been posted in the chat box. Our Instagram ID is way_organization, so please make sure to have a look at that. And within this week, we'll also be emailing you your certificates. Thank